Hello, thank you for taking part in today's presentation on engaging women in cardiovascular rehab. Our learning objectives are as follows. At the end of this session, you will be able to describe how and why heart disease is different in women, describe the importance of cardiac rehab, or CR, for women, review what is known about women-focused cardiac rehab, what is it and why it is important, review the 15 recommendations from the Women-Focused CR Guideline, describe how to feasibly tailor CR to women at your program, depending on resources, including implementation tools, and describe the role of the Canadian Women's Heart Health Alliance, CWHHA, and available resources. Gender bias in society leads to greater burden of risk factors in women. Lower socioeconomic status is associated with less access to healthy food and transportation issues. Informal caregiving responsibility leads to added stress and less time for self-care, and less time for physical activity, which is an added risk factor. Throughout a woman's life, there are hormonal issues such as pregnancy and menopause, which increase risk. Later detection of cardiovascular disease. There's less well-studied forms of cardiovascular disease such as SCAD and MINOCA. There are more comorbidities in women, less aggressive treatment, and a lack of information on medication in women, such as dosing and adverse events. All of these contribute to poor outcomes in women compared with men, and an increased risk of depression and anxiety, and consequently the increased need for cardiac rehab. We have already heard about the reasons why women need cardiac rehab, but this Canadian study shows that while there is less data in women, women may actually benefit more. Despite the clear benefits of cardiac rehab, unfortunately, there are barriers to participation. Men were approximately 1.5 times more likely to be referred to cardiac rehab than women. Despite the Canadian Cardiovascular Society's target of 85% referral of hospitalized cardiac patients to cardiac rehab, significantly fewer are referred. Certain patient groups, such as women, are less likely to access and complete cardiac rehab despite their greater need. The following are key barriers for women to attend cardiac rehab. There's lack of referral and encouragement by physicians. There's distance and transportation with related costs. There are multiple comorbidities, symptoms of pain and fatigue during exercise, family responsibilities and other constraints, and depression and anxiety, all of which lead to increased barriers. Women enjoy a variety of physical activities. Programs were developed for the preference of men. Men prefer using treadmills and cycle ergometers more than women. Women dislike being rushed and crowded and also dislike being weighed. There are privacy concerns in the change rooms. Women prefer more support from staff and peers. And there's a perceived safety of being monitored during exercise. All of these contribute to preferences in women compared with men.
For these reasons, many CR programs have developed women-focused models. We recently had the opportunity to do a review of this literature because so many sites have now done this. And this is how we summarized and defined what the programs did and offered. So many of them offered one of the following three things. So first, they would have either sessions or full programs that were women only or mostly women. They often were staffed by they had staff that were educated in women and cardiovascular disease. And they also had staff that were, enabled to deliver patient-centered, women-friendly care. The mode was also another feature of the women-focused models. So they were giving women the choice of home or center-based delivery to address their barriers around transportation and distance, and also offering them timing of the sessions, be it home or center-based, to get around some of their timing constraints, such as family obligations. Third, these programs offered content tailored to women. So some of their more preferred forms of exercise modalities, they really augmented the peer support and the staff support, the psychosocial component, as well as the education component. In terms of the effects of this. So there's also been enough research now that we can summarize the evidence of the benefits when women participate in these models. And here I first show you the quantitative results, and then I'll show you some of the more qualitative findings on the next slide. But here what you see are the outcomes of women-focused CR for quality of life. And as we all know, this is one of the most important outcomes to women. In the top, you see the results summarizing the trials that had physical quality of life, and on the bottom, mental quality of life. And for both, you see a really high, 6.5 times more quality of life with women-focused, and 4.5 times better mental quality of life with women-focused rehab. And this is compared to not usual care, but to an active comparison, such as a co-ed cardiac rehab program. So really compelling data showing that cardiac rehab, women-focused rehab, really does benefit women. We also had some other studies that we couldn't quantitatively synthesize, but I wanted to share with you some of the other positive effects of women-focused rehab. So when we had the studies that compared women-focused to just usual care, so no rehab, we did see that the women had fewer in-hospital days and major adverse events in the subsequent months. Some of their risk factors were better, such as higher HDL, and they had better psychosocial outcomes than women who got usual care. But we had really small sample sizes, so there were no differences for mortality and some risk factors, but again, the sample sizes were small and we need more research. With regard to comparisons to, again, usual co-ed CR, women-focused rehab could also be more superior in terms of morbidity, so fewer sick days, fewer emergency department visits, and better self-efficacy. But there are also some areas where we show equivalence to usual co-ed CR. And again, that might be expected because, the components are basically the same. So we saw similar functional capacity, muscle strength, some risk factors were shown to be equivalent, and some psychosocial outcomes. Again, so no harms, and definitely the opportunity for many benefits with women-focused cardiac rehab. So with all this evidence, the International Council of Cardiovascular Prevention and Rehabilitation set on a process to develop the first clinical practice guideline for women-focused rehab, and to really give some tangible recommendations to the cardiac rehab community on how to deliver women-focused rehab. You can see here on the left the rigorous process that we underwent to develop these 15 recommendations. So again, the recommendations were developed through based on the literature review and the results. And then we convened a writing panel of experts from Canada and around the world. We had a Delphi panel who completed a survey and rated the recommendations. We had a consensus call, and they were also externally reviewed. The recommendations were also subjected to the grade evidence review process. And just to say that the certainty of evidence for the final recommendations that I'm going to show you was low to moderate, with the strength of the recommendations mostly being strong. So let's take a dive into the recommendations, and there are 15, so we'll go through them a little bit quickly, but afterwards you'll hear an example of implementation of these in a program. So the first 6 recommendations pertain to rehab referral and the setting of the delivery itself, so what the rehab center is like. So first is the centrality of automatic cardiac rehab referral, so ensuring inpatients are all recommended, right? So that reduces bias, and often exploiting and leveraging electronic health records can support this. We can encourage women at the bedside, and that really informs them about, why rehab is important, that they are being referred and what to expect, and gives the opportunity for some discussion of barriers at the bedside. We also want to give women the choice of settings, so be it center-based or home-based. Women do have preferences, and some like one or the other, and even you can offer hybrid options. In terms of the environment, you want to consider, how safe is it to get there? Is it well lit? Is there privacy in terms of, weighing and the change rooms? The team themselves. So is your multidisciplinary team providing gender sensitive care? Do they have training in women and cardiovascular disease issues? And then number 6 is to really individually tailor the program to the women and their unique circumstances. So the last recommendations pertain to the delivery of the program itself. And the first one is to, not be daunted by all these recommendations. It isn't possible for every program to implement all of these. And so what we suggest is to try to be as kind of women-focused as you can. I hope that you can see within these recommendations some ways that you are already women-focused, and maybe there are a few opportunities that are feasible for you to make a few changes that would render your program a bit more engaging to women. The 8th recommendation is around choice in session timing. And again, this can overcome some of these barriers that women have around time conflicts and family responsibilities. At the initial assessment, we want to really be fulsome and consider women's context, their history, also including pregnancy-related factors, their comorbidities, their mental health and psychosocial status, etc. We want to offer them their preferred forms of exercise. In our exercise prescription and also the progression of the exercise prescription, we want to consider their musculoskeletal health, their exercise history. So what have they liked before, what has worked and what hasn't worked, and minimizing their symptoms of pain and fatigue. The psychosocial aspect is really central. So if you can't offer that within your program, maybe partnering with outside services that have really comprehensive care. Offering sex or gender specific education content. So, we do need to get the, basic safety and, about heart health kind of topics, but also adding some information around, the impacts of menopause and some of the more common comorbidities that women experience, for example. Number 14 is encouraging resilience and autonomy to support self-management post-program. So even from the outset of the program, really empowering women to be exercising in their community so that they're going to be able to maintain that, advocating that they, look at their relationship with their primary care and their specialists so that they can have really good ongoing secondary prevention post-program. And finally, that it's important when we evaluate our programs to also consider women's needs, women's satisfaction, sex differences and outcomes, and perhaps you want to look at their satisfaction with your women-focused programming specifically. So as I said, that was a lot of recommendations, but we do offer implementation tools in the guideline. So there's a link at the bottom of the slide here, and that's in the supplement of the guideline. And the very last page has implementation tools. And there are literal resources for free online that offer each of these points here to you that you can use, open access and evidence-based. So there are modules on how to implement systematic referral, as well as bedside encouragement for inpatients. There's an online course that's very brief and accredited on how to encourage at the bedside. And there's also some talking points specific to women. There are actual exercise classes recorded for women, and they also include women's preferred forms of exercise. There's also patient education sessions that are, again, this content specific to women. And then there's also some peer support groups to offer that support element offered through the Canadian Women's Heart Health Alliance.
Setting up a women's focused cardiac rehab can be quite straightforward, but it may also not go as planned. In Halifax, at the Hearts and Health in Motion program, we launched our first women's focused cardiac rehab program in 2020 and had major disruptions due to the pandemic, but we persevered and are now offering the full program model. Patients who are discharged from our tertiary care center, such as the CCU, IMCU, and cardiology floors, with a diagnosis of cardiovascular disease, have the referrals sent to cardiac rehab automatically. Referrals also come from the local Women's Heart Health Clinic and other clinics and centers. All referrals are triaged by the nurse to confirm eligibility for the program. During the assessment appointment, the team works with the patient to find the correct program fit, and the Women's Focused Program option is introduced. We offer many cardiac rehab classes and have programs on multiple sites, and at this time have only one class for the Women's Focused Program. Although it is limited, it is still very popular. As mentioned in previous slides, social interaction is one of the key recommended practice guidelines, and we have received very positive feedback on the 10-minute group discussions that are included in the exercise and education classes. Participants pick the topics using an anonymous suggestion box, and although it is facilitated by the team, it is the participants that lead the discussion. Exercise is individualized, and each exercise class is approximately 1 hour and includes not only the standard equipment and exercises, but also other types of aerobic activities, floor mat and chair yoga, breath work, weights, and stretching. The education may be on-site the same day as exercise class or on an alternative day virtually for this once to twice a week program. Education themes include women's-specific heart disease, non-traditional risk factors, psychosocial aspects, women's dietary concerns, menopause, etc. Outside of the class setting, there are many teachable moments and opportunities for tailored advice, as well as engagement in exercise planning, health change skills, and self-monitoring. Our goal is to empower women by providing non-judgmental, educational, and exercise support in a caring environment. Effort is made to incorporate conversation on the mind-body connection and address mental health concerns such as anxiety, depression, and social stressors. We make connections for the support of psychology services and social work and discuss the options for referral to mental health services. Participants also value the time available for peer support. We create a comfortable space for women to discuss their health concerns and shared experiences, and it has been powerful to watch this support in action. Patients are given the opportunity to share their contact information with each other if desired. Resources for women include exercise and networking sites as previously listed. Practical advice is provided on how to continue health behaviors post-cardiac rehab. For example, providing solutions on how to continue exercise if someone doesn't have a gym or home equipment. The nurse, dietitian, and physiotherapist teams, together with patients, incorporate self-management, behavior change skills for problem solving, and goal setting around healthy eating, risk factor reduction, and exercise training. Involving not only the patient, but also the people that provide their support can give great feedback for both the patient and future programming. We are evaluating the many outcome measures and quality indicators to assess sustainability and scalability of the Women's Focused Program.
Cardiovascular disease continues to be the leading cause of death in Canadian women. Women need CR more than men, yet women are underrepresented, so we must actively work to engage them. Setting up automatic referrals and discussing programs at the bedside so that women are informed and encouraged to attend can improve CR engagement. Women-focused CR, tailored to address women's barriers and meet their preferences, can improve their outcomes. Women-only and co-ed programs are offered on-site and are considered supervised, so opposed to home-based unsupervised programs where the patient receives weekly or bi-weekly phone calls to monitor progress. Virtual sessions where the patient is at home but being supervised through video conferencing are new to CR and may also help to address access barriers. Home-based CR and virtual programs have been implemented to overcome geographic barriers related to distance, transportation, and time conflicts. Try implementing some women-focused CR guideline recommendations into your programs to engage women better. There are many tools and supports available to assist. Feel free to reach out to the Canadian Women's Heart Health Alliance if you have questions. Now let me take a few minutes to talk about the Canadian Women's Heart Health Alliance. Sex and gender differences and disparities with respect to cardiovascular disease awareness, development, and identification, as well as treatment persist. The Canadian Women's Heart Health Alliance was established in 2018 as a network of experts and advocates to develop and disseminate informed strategies to transform clinical practice and enhance collaborative action on women's cardiovascular care and health in Canada. The National Alliance aims to improve clinical care and outcomes for women across Canada, with the goal of eliminating knowledge gaps and improving specific cardiovascular issues and practice considerations for women, and thereby improving the health of Canadian women. Consultations with stakeholders from across Canada helped identify the Alliance's 4 main areas of focus: knowledge translation and mobilization, training and education, advocacy, and health systems and policy. The goals of the Cardiovascular Rehabilitation and Women Project team within the Canadian Women's Heart Health Alliance are to: 1, enhance CR providers' professional knowledge and skills concerning women's heart disease experience by providing professional educational materials, training opportunities, patient resources, and services. 2, facilitate women's increased awareness and improve their access to CR programs across Canada. We are launching the Canadian Women's Cardiac Rehabilitation Heart Hub. This hub will maintain a national cardiac rehabilitation directory to connect women living with heart and valvular disease to outpatient cardiac rehabilitation programs and chronic care programs that are right for them and meet their needs. The Canadian Women's Peer Support Heart Hub can help you connect your clients with peer support. Social support is key to recovery and chronic disease management. Research demonstrates that social connections are especially important for women. The Canadian Women's Peer Support Heart Hub links women with local and national groups where peers with lived experience support and empower other women. The Alliance's training and education group developed a women's heart health education course that includes recovery and cardiac rehabilitation. 9 educational modules, each with a webinar, PowerPoint slide deck with speaking notes, with resource lists for trainees as well as healthcare professionals within cardiology, general internal medicine, and emergency medicine. The overreaching learning objectives of these modules are to help professionals understand sex differences and gender-related factors in cardiovascular epidemiology, disease development, risk factors, presentation, and treatment. Users can access each model for individual learning, or faculties can download the tools to present at their institutions. Importantly, it's free to access. Furthermore, it's an accredited group learning activity as defined by the Maintenance of Certification Program of the Royal College of Physicians and Surgeons of Canada, and it's approved by the Canadian Cardiovascular Society. And you can claim up to a maximum of 7 hours. The Alliance's Health System and Policy Group put together an atlas, which is published in the Canadian Journal of Cardiology Open. The chapter collection is highlighted on the CJC Open homepage and has top-rated downloads. Each chapter of the atlas is accompanied by detailed infographics that report on the current state of cardiovascular disease in women. The atlas aims to help clinicians recognize the unique aspects of women's heart health and provide policymakers with information they need to ensure equitable care for women with cardiovascular disease. Each publication includes a recorded webinar targeting healthcare providers and the general public and is available on the Alliance's website. To reach more women across Canada, particularly those at higher risk of disease, the Canadian Women's Heart Health Alliance created multilingual resources. The resources address how women's heart attack symptoms and causes of heart disease may differ, as well as risk factors unique to women, how the risk factors change over the lifetime, and ways to reduce your risk of heart disease. To date, the resources are available in 15 languages. The resources were professionally translated and reviewed by healthcare providers, patient partners, and members of each community. We encourage you to view, download, and share the PDFs and videos with your network and help raise awareness about women's heart health. Wear Red Canada is celebrated annually across Canada on February 13th to raise awareness about women's heart health. Proudly hosted by the Canadian Women's Heart Health Alliance and powered by the Canadian Women's Heart Health Centre, events are held online and across the country to serve as a reminder for all Canadians, but especially Canadian women, to be mindful, curious, and proactive in the management of our heart health and wellness. You can participate by 1, wearing red on February 13th to show your support, taking pictures and sharing them on social media using the hashtag HerHeartMatters. 2, sign up a team for the National Wear Red Canada Movement Challenge. 3, order a clinic promotional kit with clinic posters, buttons, pens, and brochures. 4, organize an awareness event at your workplace. 5, light your clinic or hospital in red. More details can be found at wearredcanada.ca. Here are the references in today's presentation. The Canadian Women's Heart Health Alliance is a network of advocates and experts from across Canada. More information regarding the Canadian Women's Heart Health Alliance can be found at CWHHA.ca. You can also email us at CWHHC@ottawaheart.ca. Thank you for attending today's presentation.